Sending of Ebola virus in an asymptomatic pregnant woman. Description: in the West Africa, the worst outbreak of Ebola virus disease (EVD) in the history is continuing with more than 11,100 deaths caused by the SARS species. Symptoms including fever, headache, body pain, nausea with vomiting, diarrhea, and hemorrhage, and symptoms of septic shock on the multi-organ failure. We have a video.
The Ebola virus infection is systemic, meaning that it attacks every organ and tissue of the human body except the bones and skeletal muscles. Ebola HF is marked by blood clotting and hemorrhaging. Although it is not known exactly how the virus particles attack cells, it is postulated that one factor that allows them to do so is that they release proteins that dampen down the immune system response. The Ebola virus attacks connective tissue, multiplying rapidly in collagen. Collagen is the tissue that helps to keep the organs in place. The tissue is basically digested by this virus. The Ebola virus causes small blood clots to form in the bloodstream of the patient. The blood thickens and the blood flow slows down. Blood clots get stuck into blood vessels, forming red spots on the patient's skin. These grow in size as the disease progresses. Also, blood clots does not allow a proper blood supply to many organs such as the liver, brain, lungs, kidneys, intestines, breast tissue, testicles, etc. Spontaneous bleeding then occurs from body orifices and gaps in the skin, such as needle puncture marks and rips that can suddenly appear. Death is caused by huge loss of blood, renal failure, or shock.
Death is caused by huge loss of blood, renal failure, or shock.
Case: a 31-year-old woman in the late state of 50 pregnancy who has no history consent in illness or use for long-term medicaments present to the hospital with suspect of premature rupture of membranes.
Adama, our first patient, admitted, is a very special case. She's going to be discharged today. She's cured. So we're going in to do her discharge shower so that even though she's not infectious, maybe some of the items that have been in the confirmed tent are. So we're going to do a shower to disinfect everything, give her new clothes, and then she'll be able to walk out as a cured patient.
And then she'll be able to walk out as a...
So Adama arrived. We knew she was pregnant. We didn't quite know exactly how far along. She ended up losing the pregnancy quite early on, and some complications from that extended her stay in the confirmed tent with us, but she's now recovered. But of course, there's a lot of trauma and psychosocial support that'll need to come with having lost a pregnancy. Also, some of her family members have also died. So now this is just one part of her journey now that she's recovered, but a big step will be going home and kind of the aftermath of everything that comes with Ebola. So a new, having to adjust to a new family and the community as well.
Having to adjust to a new family and the community as well.
She was referred to ELWA3 Ebola Treatment Unit. In Monrovia, Liberia, was a common practice of Monrovia for the patient who potentially present a hospital exposure risk, such during delivery. On admit to ETU, he had mild lower abdominal pain and sparse contractions and reported fetal movements. During event of 3 days, she became mildly febrile and was considered to be symptomatic AVD during the following days, additional to AVD association signs: vomiting, diarrhea, bleeding, semicortex develop, she dies with the baby in the utero after 7 days of admission.